Good evening. We begin tonight with some catastrophic gaps in Canada's social safety net on child poverty and a public health crisis on painkillers. Ottawa will hold a summit on opioid addiction later this week, but today there was a cold, hard dose of reality. Emergency responders found 3 bodies in a Winnipeg home along with white powder believed to be fentanyl. A new report says 13 people are hospitalized every day in Canada because of opioid overdoses. That's up 30% since 2007. The fastest rise, 62%, was among young people between the ages of 15 and 24. And seniors also make up 1/4 of the patients, mainly accidental overdose. As CTV's medical specialist Avis Favaro reports, that is rarely the case with young people.
These are some of the faces of the more than 2,000 Canadians dying each year from opioid overdoses. Logan Mullins of Edmonton, Brittany Janelle of Winnipeg, Brittany Cobbing of Kitchener, Ontario, Danny Schultz of Edmonton. 2016 is set to be the worst on record for overdose deaths to powerful painkillers and black market opioids laced with powerful fentanyl.
People could swallow their tongue, they could choke on their tongue, they could aspirate on vomit.
These drugs were designed to ease pain, but their overuse has caused hundreds of thousands of Canadians to become addicted. Like this man, who says a wisdom tooth extraction got him hooked.
My doctor, he just wrote me a prescription. Try this. Here you go. Have a nice day.
And this woman, given painkillers for an autoimmune disorder, she became addicted.
I've lost my home, I lost my children, I've lost everything.
That's why the federal government is holding a national summit on this opioid crisis in Ottawa on Friday.
It could potentially represent a turning point in how this crisis is being addressed. And I think
this toxicologist says that among the many solutions to be discussed are better controls on how doctors use these pain medications.
It's now an entrenched practice that we resort to opioids liberally for chronic pain, and we go up to doses that were unheard of 20 years ago. That harms people.
Also being discussed are national systems to monitor prescribing and dispensing of opioids, more addiction treatment services, and more safe consumption sites where addicts can use drugs safely.
And the success of the upcoming summit, Lisa, will be measured in the number of lives that will be saved.
Now, you say, Avis, in your story that this summit could also be a turning point. Who's going to be around that table?
Well, this is unprecedented. They're going to have politicians, you're going to have law enforcement, you're going to have doctors, and there'll also be the pain patients who need these medications to keep them in reasonable shape. And they will be coming together to try and make sense of it because right now it's out of control.
All right, Avis, I know we'll have extensive coverage of the summit. Thank you for this tonight.